Hello, we are lucky to be with Katie Mahoney at the Epstein Becker Green Annual Workforce Management Meeting. Katie, I have a few questions for you. What are the health policy concerns or challenges that the employers face right now?
There are several. I think when we think about the challenges facing employers, there are some on the administrative side in terms of paperwork that's required, notices that are required, reporting requirements that are imposed on the employer community with regard to the Affordable Care Act. Then there are substantive challenges with regard to health policy. How can employers better tailor their health benefit programs to their employees? How can they offer greater flexibility? How can they provide health care coverage at an affordable cost? And what type of coverage should that be? There's a lot of uncertainty right now with the failed efforts to repeal and replace the Affordable Care Act. And I think employers are really looking for Congress to step up and provide additional flexibility and some relief, both on the substantive side and on the administrative side, to allow them to better serve their employees and provide the health care coverage that makes sense for their employees and themselves.
What have the administration and Congress done to address these challenges? I think you answered that.
Not much, sadly. I think that there's been, an ongoing struggle over the past 7 years about what healthcare coverage should be. Should it be soup to nuts coverage that covers a whole swath of all different benefits? And if so, what is the trade-off? The trade-off is cost. Nothing is in a vacuum, and so to the extent that soup to nuts coverage is a great thing, yes, but only if you can then afford that coverage. And so, I think what we're struggling with as a country is the idea that if we have a private health insurance sector that pays for our healthcare services and we want coverage, where is the fine line between covering the right amount of things and making sure that health insurance is affordable? And from our perspective at the U.S. Chamber of Commerce, we view that as a market choice. And so we would like to see a broad array of different types of options available to individuals. So more modest coverage that is available at a lower price, as well as comprehensive coverage that is perhaps available at a more expensive offering.
What should employers do in light of the environment in Washington?
I think they need to talk to their attorneys and figure out what is happening in their communities, what are some of the bright and innovative things that are happening in their specific sector. We're seeing great benefit design innovation happening all over the country with value-based insurance design offerings, tiered networks, more discrete formularies so that coverage is perhaps more affordable for employees. And I think, sadly, Congress is not going to be able to help employers in the short term. And so I would encourage them to talk to their attorneys and their benefit advisors and learn about what is happening in the private sector.
Thank you so much. Appreciate it. Thank you.